insomnia, sleep apnea and body clock disorders, we can anticipate that somebody in their lifetime has a 40% chance of acquiring one of those sleep disorders.
Why are we struggling with sleep? Is it stress? Has it gotten worse over time?
It's our lifestyles. We live in a gig economy world, so there are more and more people that are working into the evening in service roles, holding down more than one job, which is causing them to be up working late at night. We do have a sense that people who use various forms of medicinal cannabis do obtain this calming effect, so almost like reduced anxiety levels, reduced hyperarousal.
I was born to be free.
Professor Darren, thank you so much for coming to the Bloomley podcast.
My pleasure.
Very excited to have you here to talk about all things sleep, which is, I think, a common issue that most of the people in the Bloomley community are dealing with, but I think across Australia as well, we're just not getting enough of it.
That's right, and we all do it, and we can reasonably expect if you live to 80, you will have spent 25 years of your life asleep. So it's nice to know that you're using that time productively.
Well, yeah, when you put it like that, 25 years. Okay, well, I think that you obviously know that we're here to speak about medicinal cannabis and sleep. It's something that we're seeing being prescribed, cannabis being prescribed for most commonly now is sleep, with a lot of chronically ill individuals suffering with sleep overall. But what I wanted to cover is the different types of sleep conditions and disorders that we're seeing across Australia at the moment.
Sure, and there's a lot of sleep disorders where there's three main, the most common ones. So insomnia, sleep apnea, and circadian or body clock disorders would make up the majority of the common sleep disorders, and there are some less frequent ones in addition to that, disorders of excessive sleepiness. But let's stick to the three main common ones: insomnia, sleep apnea and body clock disorders. We can anticipate that somebody in their lifetime has a 40% chance of acquiring one of those sleep disorders.
Right, okay. So body clock, so is that you're saying that is that issues with falling asleep or staying asleep?
That's and it can be both. It's to do with the timing of the sleep. So conventionally, our body clock is regulated by the day-night cycle, so that we get sleepy and our desire to fall asleep occurs at a certain time into the evening.
Right.
However, the alignment of that body clock is not always in line with people's daily routines or the night-day cycle, and that can cause problems with difficulty, therefore, in getting off to sleep and then a tendency to want to sleep in the subsequent day, or the reverse problem of falling asleep very early in the evening and then waking in the early hours of the morning. So that misalignment creates a period with perceived sleep difficulty. It's not a true insomnia. If they allow their body to sleep in accordance with their body clock, they'll get the regulation number of hours of sleep, but it's just seemingly at the wrong time. And body clock disorders can also occur in shift workers, and of course it occurs very commonly in jet lag.
I know that we spoke about this when you arrived, but you said that, is it 40 or 50% of individuals living with sleep conditions or disorders currently in Australia? Is it 40%?
Yeah, maybe over a lifetime we'd anticipate, but at any given time, if you take one condition such as insomnia, and a little bit according to how you wish to define it, but chronic insomnia might be 8 to 10% of the population at any given time.
Right.
Body clock disorders might be 5% of the population, and sleep apnea similarly 5 to 10% of the population at any given time. So we're talking something that's extremely prevalent.
Has it gotten worse over time? I'm trying to understand, why are we struggling with sleep? Is it stress? has it gotten worse over time during?
There is evidence to suggest that, and in particular, it's our lifestyles.
Yeah.
Okay, so we live in a very different world to 20 to 30 to 50 years ago. We live in a gig economy world, so there are more and more people that are working into the evening in service roles, holding down more than one job, which is causing them to be up working late at night. Okay, so there can be people as a result of this that are getting insufficient sleep and actually pushing their body clocks into a maladaptive time zone as well.
Right.
So body clock disorders can occur with these people that work these shifts.
Right, okay. So what's commonly prescribed? What are we seeing most doctors prescribing for sleep? I know that, melatonin, when I think of sleep, I think of melatonin for some reason.
That's right, and it's a natural hormone, so our bodies make melatonin, and melatonin is one of the hormones that helps us to regulate our body clocks. So as we get sleepy, it will be a cue, in part driven by a melatonin rise secreted from the brain, which will trigger that sleepiness. So we do use melatonin in a number of contexts, one of which is actually to help us regulate that body clock. In fact, that's one of its more powerful uses, is in body clock regulation. So we use it a lot in people where their body clocks are either delayed or in jet lag, or in some instances in shift workers. And it's more effective in that role than it might be for insomnia, where its effect is a little bit more modest.
Right. So I think when we're speaking about cannabis, I think most people, when they think about the consumption of cannabis, naturally they think of sleep, right? It's just something that comes hand in hand with cannabis. But I think what would be really interesting for everybody is to understand how cannabis helps, or will potentially helps, falling asleep or getting to sleep. And I think it would be really helpful to understand why cannabis helps with sleep and what we're seeing from the research so far, which I'm sure is minimal.
Well, that's right. There's not a lot of research on the role of cannabis in sleep disorders, and we hopefully will correct that over the course of time. But let's just take a step back and talk a bit about insomnia and what it really is. And insomnia is either difficulty in getting off to sleep or maintaining sleep, such as waking during the night and then having difficulty getting back to sleep. That symptom, particularly if it's chronic, can be associated with a lot of frustration, a lot of dread even, in terms of going to bed at night knowing that you'll then have difficulty with either your sleep onset or your sleep maintenance. And that response, that psychological response or emotional response, is one of the contributors to this concept of hyperarousal.
Right.
So if we are stressed, frustrated, anxious about our sleep, it is not conducive to getting off to sleep and contributes to this thing called hyperarousal. There's other forms of hyperarousal too. Some people will be hyper-aroused around some other aspect of their life, which then poses the barrier to sleep onset, or for that matter, waking during the night and then becoming stressed or agitated about something else that prevents them from getting back to sleep. So we need a target for hyperarousal. And it's difficult for people to calm themselves when they're in this mindset. It can be done with practice and it can be done with training, and we do really encourage people to do that and to get professional help at times to assist with strategies to deal with hyperarousal. However, sometimes it's a night-by-night occurrence. It doesn't occur every night. It occurs occasionally. And there might be opportunities to look at simpler solutions that would work in that context rather than seeking professional help, which might be expensive, might be hard to come by. And we are searching for simple products that might assist with this, that could be safe and effective. Now, at the moment, we have sleeping medication, which can be effective. It has its issues at times with safety. Some people will feel that their sleep quality is paradoxically almost adversely affected by a sleeping tablet because they can feel groggy the next day. If people are not careful with the use of these medications, then the usage can build with time, and then there can be an excessive reliance on these medications, which is also a concern. And we know that historically over the last 40 years that these medications that have been prescribed, that there needs to be a lot of care in the prescription of these. And general practitioners need to understand do understand their responsibilities by and large in relation to this, and they're not always comfortable about prescribing on a regular basis. So we need safe alternatives. And forms of medicinal cannabis could quite possibly serve as that safe alternative. It has not yet been well enough studied. We don't know quite enough about how effective or efficacious these are, or for that matter, entirely whether they're fully safe. But it is certainly a promising option that we're exploring at the minute. And we do have a sense that people who use various forms of medicinal cannabis do obtain this calming effect from it. So almost like reduced anxiety levels, reduced hyperarousal. And that might be one of its mechanisms of action, more so than outright sedation, which is what we obtain from a sleeping medication. So people with difficulties with their sleep onset, where they feel aroused or hyper-aroused or stressed, or for that matter, some people will wake during the middle of the night with the similar symptom, this could be a possible option for them, which needs further studying and further exploration, but it's certainly showing some preliminary promise.
So you spoke about the fact that there is pretty anecdotal evidence when it comes to cannabis and sleep, but I mean there must be some research. I mean, I know that I've seen some over, my many years in this space, and I know that again it is anecdotal, or it's self-studies, which I think are just as important. I'm hearing directly from the patient, but from what we understand, what have you seen so far in your learnings?
Yeah, and indeed there is anecdotal evidence of people who report benefits from these, and I've seen that as a first-hand experience. People that feel that these medications offer them a lot of assistance with that sense of hyperarousal. The best evidence that we can get is randomised controlled trials, whereby we will randomly select patients into treatment or a placebo and study them over a period of time. And there are remarkably few of those trials to date. There is one that was conducted in Perth that used the combination of CBD and THC and showed an effect, a positive effect, and that was a promising study. Although we have very few other trials that have been conducted to date that are clearly showing an effect one way or the other. So we remain a little uncertain. What's more, we remain somewhat uncertain as to which of those two forms of medicinal cannabis is providing most of the effect. Is it CBD? Is it THC?
Yeah.
Do you need the combination? Or for that matter, what is the optimal dosage of these medications or these substances? And this remains unknown.
Yeah. And it's so hard because everyone's response to cannabis is so different. So how do you quantify that to a certain degree when it comes to, I guess, what works for somebody might not work for somebody else? And I mean, that's the struggle that we've always had with cannabis, right? But from what I've heard, I know that a lot of people really have leaned on CBD for sleep. But again, going back to what you were saying about these arousal is it arousal states, is that CBD is really helping with the management of stress. So if an individual is taking that throughout the day, as an example, they're finding it maybe easier in the night to relax and rest and calm down. That's from what I heard, but something.
Yeah, and indeed that's very, very possible. And at this preliminary stage, the most likely mechanism of action. Interestingly, we can't find a receptor in the brain for which a medicinal cannabis attaches to that has direct sedative properties. Now, that's not to suggest that that receptor does not exist, but we still remain somewhat unclear as to whether is this actually a sedative or is this a substance that gives us a calming effect. And by that calming effect, it facilitates natural sleep onset. Right. And that will be very interesting too when we study this in more detail to work out which subgroups of people with insomnia may respond. So, for example, as I referred to earlier, those with that sense of hyperarousal may be the ones that respond better to a substance that offers a calming or an anxiolytic effect. There are some people whose sleep routines are just generally poor. They might spend too long in bed, they might nap during the day, and it may not be driven by a sense of hyperarousal. And it's not clear that that person, for example, would benefit from any form of medicinal cannabis that in the absence of a direct sedative effect.
Right. So there's no definitive answer on whether CBD or THC is better.
Now, this one study that was conducted in Perth used the combination of the two, and so that is one of the better studies that we have to suggest that in combination there is a useful effect. What we don't entirely know is if you separate these two substances out, which one is providing the majority of the effect or not, or, for that matter, whether the combination is important.
Yeah. It's so interesting when we're speaking about cannabis, we're always referring to CBD and THC because there are two most well-known cannabinoids. However, we know that the cannabis plant has hundreds of cannabinoids, and I know that one that is spoken about quite frequently when it comes to sleep especially is CBN, which is a minor cannabinoid of the cannabis plant. Do you have any feelings or inklings on whether you think that some of these minor cannabinoids could maybe play a role in better sleep?
And the answer is, again, without sounding like we're saying the same thing too often, is that we don't entirely know.
Yeah.
And this is going to be one of the great challenges is if you take the plant-based cannabinoids that have been recreationally inhaled, where people will then absorb a number of these substances, which ones are providing the key effect. And I guess in medicine, our job is to take the major ones and test them, and then look at efficacy, look what happens if we add in the minor ones or take the minor ones in isolation and test them as well. So we can see that this process is going to take a lot of time to get more certainty around it. And as you point out, THC and CBD are the most well-known ones, but there's a number of minor ones, and they are certainly getting a lot of discussion and a lot of airplay. Unfortunately, they're still yet poorly studied. And these substances are better studied in other conditions, and insomnia, although it's extremely prevalent, has really to date had to wait its turn to be properly studied, and that's really starting to take place now, in part because I think there's a great deal more awareness of sleep disorders. There's a recognition also that getting help for your sleep problems is not always readily available. Expertise around managing sleeping conditions and insomnia is not widespread beyond the 7 or 8 healthy tips for a good night's sleep, which may not be enough for everybody. And what's more is that sleep problems, difficulty sleep, are not necessarily an occurrence every night of the week. Many of us have sporadic occasions or clusters where we will sleep poorly, And then brief interventions might turn out to be one of the better options rather than professional help if we have clearly efficacious ones and safe ones.
What are some of your tips to maybe our listeners on better sleep outside of cannabis whilst we're talking about better sleep routine, I'm assuming? What are some tips that you would recommend, given, this is your area of expertise?
The most common scenario that I will see in people who come to see me who have been sleeping poorly for an extended period of time is a compensation where they'll spend more time in bed in order to get that catch-up sleep. And
don't blame them.
And it makes intuitive sense. If you're lying awake in the middle of the night and you eventually fall asleep, you may want that catch-up sleep into the morning. It's interesting how that compensation becomes the propagator of a long-term sleep disorder. So it is more common for me to see people in bed 9 hours, sometimes more than that. And the first thing that we will do is encourage them to spend less time in bed. It sounds counterintuitive to a degree, but by spending less time in bed, inevitably, it means less wakeful time in bed. And the wakeful time in bed is usually an unpleasant and stressful time for these people. It contributes to the hyperarousal. Just lying in bed, staring at the ceiling in the dark is an unpleasant experience.
Yeah.
So minimizing that time by shortening times in bed. That's the first thing that we'll often suggest. Avoiding napping. However, brief naps are usually okay. So people who do get sleepy during the day, a 10 or a 15-minute nap is okay. It's actually quite restorative. It minimizes that sleepiness, but it won't pinch sleep from the next night in the way an extended nap would. So brief naps, they're okay. Long naps, more than 20 minutes, we really discourage them.
Okay. So we can nap.
We can nap.
We can nap.
In fact, we would even encourage it with people who are sleeping poorly at night, who have periods of sleepiness during the day. It affects their productivity. It might even affect their safety if they're driving, for example, or operating machinery, or some of these tasks that require intense concentration, but they're sleepy at the time, they may perform them quite poorly. Brief naps will reverse that sleepiness quite effectively, at least for a period of time, sometimes several hours.
Okay.
So we do encourage that if people are sleepy during the day.
Right. Okay, so yes to naps. That's all I took out of that conversation. And
Yes
I'm
to
all
naps.
for it.
Make them short.
Make them short and sweet. One question that I do have, and especially when it comes to cannabis as well, because I know that this is spoken about, is hitting REM. Now, I don't know much about hitting REM, but maybe you can talk me through what that means. But I know that when I've read about cannabis and sleep, REM is something that's often discussed, and that sometimes individuals who are consuming cannabis struggle to hit REM. Again, I don't know how studied that is. Maybe it was just an article that I read, but can you comment on hitting REM and what that means firstly, and maybe if you've seen any research on cannabis and hitting REM sleep?
Yeah, there's been a couple of studies that have been in Sydney now, which pleasingly have not shown a detrimental effect on the REM sleep amount, which is good. Okay, and these are in conventional.
What REM is? What REM sleep is?
So our REM sleep is our rapid eye movement sleep. It's most conventionally understood as that's our dreaming stage of sleep.
Right.
Okay, and it tends to occur later into the night. So maybe the middle of the night might be the first REM sleep period, and then maybe 2 or 3 more of those episodes throughout the remainder of the night. Many of us wake from sleep in the morning from REM sleep. That's the dream people always remember the most, is the one that they wake from.
Right.
REM sleep is an interesting stage of sleep. The brain is busy, the brain is active. If you measure brainwave activity in REM sleep, it looks like the brain is actually awake. And yet you are deeply unconscious and quite hard to rouse at that stage. And this is a busy time for the brain where we believe it is taking information that it has experienced and processing it into long-term memory. So it's a very active stage. And we think sleep across the board, one of the important functions of sleep is in the processing of information and experiences that have been encountered in the previous day or beyond, and then putting this info and packaging it into long-term memory, and also releasing some of the other older unused memories, which would then subsequently disappear. So whilst we're busy achieving all of this, we seemingly must be unconscious, because it's quite hard for the brain to be processing the environment and be busy doing this other task of actually trying to get information into long-term memory. So this concept that we have to go unconscious to achieve this task is really what sleep represents. Right. That state of unconsciousness, our brain is busy doing a different task, doesn't cope with doing two things at once. Not just the boys' brains.
Right. Right. So ideally, should we be hitting more REM in our sleeps or not? Is the goal to hit REM when it comes to sleep?
Yeah, so the REM sleep is important for that task of putting information into memory. We can do experiments on people where we wipe out their REM sleep entirely and then test their performance the next day on a task they learned the day before. And they're often quite poor at it. They'll often take on this same task or a puzzle as though they were doing it for the first time. Right. And that experiment's been done many times now. So there is a real learning role, particularly in REM sleep. It's different from the deep stage of sleep. So if you think of brainwave activity, we have very slow waves, which are sort of tall. Just think of a wave in the ocean. A big, tall wave is our slow waves, and that is the stage where we think the brain might be getting its most actual rest, and it's restorative. So that if that stage is lost, there is a stronger sense of waking up that next day, not having the restorative effect of sleep. But then we'll move into the REM sleep where the brain is quite busy again. And when we are measuring these in sleep studies, sometimes even us can have some difficulties separating, is this person actually now in REM sleep or are they waking up? Because they look quite similar to each other when you look at the busyness of that brain, high-frequency brainwave activity. There are some other clues. We will see the eyes moving backwards and forwards, which is a peculiarity of REM sleep. It's exactly as the term describes. The rapid eye movements is what helps us to pick that this person is now actually deeply unconscious with a busy brain in REM sleep.
Right. Okay. Interesting. Learning a lot about sleep. So question that I have in regards to the study that you referenced before in Perth, the Perth study. So you spoke about it being a balanced product, so half CBD, half THC product. Was it a tincture, an oil delivery?
Yes,
it was.
So these are mostly packaged as an oil. And as we know, most forms of medicinal cannabis, they're very lipid soluble or fat soluble. They're actually quite hard to absorb. And so in any form of ingested form as an oil, we need reasonably high doses to get much effect. And this is possibly one of the issues that we have with getting full effectiveness from oral versions or oral prescriptions of any form of medicinal cannabis, is the absorption is not as high as other forms. So inhalation, for example, is a better mechanism to absorb medicinal cannabis or any forms of cannabis through the lungs.
'cause it's quicker.
It's quicker. It gets past that fat solubility issue.
Is there, and I mean, we know that in Australia at the moment there's over 800 different products and multiple different delivery methods, whether it's, as you mentioned, flour through vaporization. We have tinctures, there's pastels, creams. I mean, there's numerous delivery methods. Is there one that stands out? I mean, obviously in this study that you reference, it was a tincture. Is there any other delivery methods that you've seen spoken about when it comes to research around sleep and medicinal cannabis?
Yeah, people are getting more clever with how to actually get improved availability if it's ingested orally for something that is a fat-soluble substance. And I'll talk more about the study that we're involved in currently, which is using vitamin E to package the medicinal cannabis. And vitamin E is effectively like a form of fat. It's very fat soluble, but it really facilitates the absorption of the medicinal cannabis substance. So this is being explored at the moment as ways to improve the bioavailability, and we may find that some of the variability in some of the studies today to produce an effect might be, in part at least, contributed to by varying degrees of bioavailability. And as you point out, there are so many different ways to administer these types of substances. And again, we're not entirely sure ultimately what is going to be the best way to do it. But best has also got to be something that's practical as well. I mean, oral ingestion of a substance is very practical, but it just needs to be fully effective in terms of its bioavailability, and there's a lot more work that is likely to be done in that area.
Yeah, agreed. Yeah, it's it's interesting that you mention, I think that most people, when they're considering cannabis or they think about cannabis, they're always assuming a flower, right, a dried flower. But it's so nice to have these other options available to people who, are new to cannabis. And, there's something a little bit more discreet and more medical. I would say a tincture is a little bit less daunting, yes. I think, for a newbie essentially coming into cannabis. And I find it to be, it's really exciting for the industry that there is so many different delivery methods that people can now lean on as well that is outside of the dry flower scope. But you mentioned you have a study coming up, and I'd love for you to tell us a little bit more about the study and how maybe some of our listeners could potentially get involved.
Yeah, so this is a really important study because it's the largest one that will have been conducted worldwide, and so we are looking at over 400 participants to contribute to this study nationally. And these are people with insomnia symptoms, difficulty with their sleep onset or sleep maintenance for a period of time, so at least symptoms over the last 3 months or longer. And we're looking at the more moderate to severe insomnia sufferers that would be interested in participating in a trial that's looking specifically at CBD, which is administered packaged in vitamin E. So we believe that it will actually facilitate the bioavailability, increase absorption as a result of that. And we're looking if this will help with people's sleep onset or their sleep maintenance. And so if people are interested in participating in the study, they'd be most welcome. And there are a few entry criteria, so they can't be on any other sedatives at the moment. So we have to have people weaning off sedatives if they're on them at the minute for at least a month. So sleeping medications, antihistamines, or other forms of medicinal cannabis that have been used recently have to be deferred for the purposes of this trial. But we would be very interested in talking to people if they're showing an interest in this trial.
Absolutely. And I'll share all the details in the podcast information as well, so anyone listening can find it. Out of curiosity, why did you choose CBD and not THC purely for this study? Was there a reason that you decided to choose just CBD?
I think CBD has there are implications in driving with some forms of medicinal cannabis. Some of them come up on a drug test. CBD appears to be probably considered to be the one that's most safe in the driving context. So there are the fewest restrictions around the ingestion of this particular form of medicinal cannabis, particularly for the purposes of a large trial, which is conducted, with its safety monitoring committee and so forth. So there's a number of aspects that we have to consider when choosing what agent or substance that we would like to study.
Do you see, because this is your area of expertise, do you see more investment moving forward into the future into medicinal cannabis and sleep? Like, do you think that we're going to see more studies and more clinical trials from your position?
Yeah, and it's still early days, and the whole field of medicinal cannabis is across the board is in its early days, from epilepsy to pain to all kinds of potential uses for these substances. And so there's still so much that we don't know about them. But we know that what we have at our disposal is quite inadequate to help people who sit in that 10% of the population that may have insomnia symptoms on a regular basis. There are limitations with quite a number of the sleeping medications. There's a lot of limitations in access to professionals that are skilled in providing good recommendations or treatment plans for people with insomnias. And as I say, insomnia is such a moving target. It can fluctuate enormously from one day or 1 week to the next. And so there is potentially a role for medicines that are deemed to be safe, deemed to be effective, that can be used on those reactive short-term basis. There would seem to be a role for that, and so that's why this does need to be studied. And ultimately, we find what place would this sit in all the options for treating people with their sleep disorders.
Absolutely. How comfortable, again, I'm assuming in your position you're dealing with doctors day in and day out who are specialists in sleep. How comfortable are you? How comfortable do you think that doctors are in prescribing cannabis for sleep? Given what we know, and given we know that there's not a lot out there, do you think there's still reluctancy in doctors prescribing it? Or do you think that, I know that, again, we're in our infancy at the moment in this industry, but are we seeing more doctors, from your perspective, prescribing cannabis for sleep?
I think we're still very much in the early days of that, and for several reasons. And one of the key reasons is we still yet don't have good evidence. And many, if not most, doctors are more comfortable in prescribing when they have proof that it works and it's safe. And the role for where this might fit in is being clearly defined. And some of those things have not been set in place at the moment with the evidence that we have. And so there's a natural reluctance. The medical community, by and large, can be quite late adopters, although we may see a number of people or groups of people anecdotally that have had response, but it doesn't always mean that the doctors are in a great rush to be early adopters. So I think there is a lag, and that lag is there for good reason, but sometimes we have to be mindful to get this evidence can take quite a long time to accumulate, and people are looking for solutions today, unfortunately. So we accept that medical professions are often slow to adopt, but that's why these studies need to be done to see not always to hurry up the medical profession, but really for us to illustrate what role these substances might actually have in the overall management of insomnia, because we do still point to making sure that people's general lifestyles are addressed first. So healthy routines, healthy sleep routines are still the cornerstone of the management of either short-term or even long-term insomnias, and we would still always put that first.
No, agreed. No, I think that it's exciting to see patients and, consumers of cannabis speaking out about their experiences with cannabis and sleep. I think it's important. But again, it's also important for, our educators to feel comfortable in prescribing cannabis as a treatment option as well. But that can only happen with research like what you're doing, which is fantastic.
Indeed.
Yes. Well, thank you for coming to the pod. I really appreciate it. And that's a wrap.
A pleasure. Thank you.
Thank you.